I'm here today with Dr. Okubadejo, world-renowned spine surgeon and fitness enthusiast with 3 patents on fitness equipment.
Absolutely.
Let's start with medical. Have you always been inspired to want to go into the medical field and help people with their health, or when did that start for you?
Absolutely. So my parents were both in the medical field. My dad, a pharmacist, mom, a nurse. So I saw from a very young age kind of what it looks like to work hard in the health field, to take care of patients, and just the pride and consistency involved. So my head was always kind of geared towards that. And when I started school, I was very good at math and science, so it felt like a natural fit. So going into undergrad, I delved deeper into that. I did a lot of volunteering in hospitals. I was very into sports as well. And I felt a good merger between sports and medicine would be orthopedic surgery. So I started med school thinking orthopedic surgery. And then while in residency, getting into orthopedic surgery, I tried to see where within ortho I was most inspired. And there's something about the complexity of spine. Not everyone has the desire to delve deeper into spine. You know, it's very delicate, very intricate, and it just kind of fit the way my mind works. So for me, it was a perfect marriage. So I'm an orthopedic spine surgeon. I've been in practice now almost 2 decades, and it's been a blast.
So we talked to a few of your patients. Let's start with Megan Farmer first. She's an actor, a stuntman. Wow, did you feel any sort of added pressure because she actually used her body as a tool for her everyday work?
Absolutely. When Megan came in, she was in a lot of pain. I knew what she did as a stunt woman. I wanted to make sure I gave her the absolute best result because I wanted her to preserve and be very highly functional. A lot of patients who have active lifestyles are often concerned about how they could continue if they end up having surgery. But if your pain limits your ability to perform, then surgery is absolutely necessary. And it's my job to make sure I deliver, that I do a good job with the surgery, and I get you back to your life. So with Megan, she came in, she had a herniation in her neck. She went through some preoperative treatment, physical therapy, injections. The pain persisted. Ultimately, came up with a diagnosis and a plan, and executed, and she did great.
Megan mentioned several times that she visited several different doctors in order to make the best decision for herself. Why do you think that you were the one who won in the end, that you were the best choice for her?
My priority, other than executing surgically, is patient education. So I go through why they have pain in a lot of detail. I go through the imaging in a lot of detail. My patients and I sit side by side so they can see exactly what's causing their pain. We talk about what they can do prior to surgery, if they can avoid surgery potentially. And ultimately, the decision for surgery in most cases is a patient's decision because the patient knows what they're feeling. So my job is to really spend a lot of time educating and making it feel like it's a partnership between myself and the patient. I want my patient to go out and learn as much as possible. And I hear often that when they contrast their experience with me to other surgeons, is other surgeons don't have that same patience. They don't go into as much detail. And for me, that's a huge priority. Right? My patients have to be educated. I want them to go home to their family members, their friends, and describe the surgery in detail, honestly.
So it seems like in addition to being a provider for your patients, you're also a wonderful partner, making sure to make it make sense for them. Also, you are famous, world-renowned too, for your wonderful bedside manner. Tell us a little bit about why that's so important to you.
I think it's critical for a doctor to have empathy. So when I talk to a patient, I'm with the patient, I picture myself being in their seat, right? So with my experience, I'm armed with a lot of knowledge, a lot of experience as to how things should go. But for the patient, most times it's the first time for them. So I put myself in their shoes and I envision what I would want my provider to give me in terms of education, in terms of energy, and that's exactly what I try to deliver every time. Because for each patient, it's individual and unique to them. So I think as long as the surgeon has that mindset, then your patients will feel comforted and they'll feel that it's a partnership with the decision-making. It's not just me lording over them saying, hey, here's your problem, here's my plan. It's, hey, here's what's going on, do your research, know as much as possible. I want you to feel very comfortable. And that way the outcome is almost predictable because you know what's happening before you go in.
So tell us a little bit about having to work with multiple parties or relationships of your patients in order to make the whole experience successful.
I've had a lot of patients come in prior to meeting me where they'll say they spoke to family members, they spoke to friends about a spine problem they were having. It's critical that I educate my patients so they can communicate the same information to their parents or their family members and have the right energy. So if I meet the family directly, I try to allay any fears. I try to make sure they feel comfortable with my approach. And that oftentimes leads to everything going very smoothly. When it comes to just misconceptions, I think the more time we spend with education, the more you can allay any misconceptions or any false perceptions as to how things should go. So I think kind of spending that time to make sure things are clear allows for things to go very smoothly.
What does that road look like after they've completed their surgery and throughout the course of the rest of their recovery time?
Communication is critical. So I communicate before surgery, I communicate immediately after surgery. I let them know exactly how the procedure went. The follow-up is critical. So most patients come back into the office 2 weeks post-op, and we go over details of the procedure, details of what they need to do to have a good recovery going forward. So I spend time educating them about what has been done, what healing looks like, and to be patient with their bodies, and to give a realistic time frame as to what it takes to recover. So if you feel the need to continue to see me beyond 6 months or a year, it's a partnership. I'm not going anywhere. So my patients keep coming back. I keep educating them. I keep reassuring them, and I make sure they transition back to the life that they want.
Tell us about kind of all of the family of practices that you have and how that came to be.
So I'm from Brooklyn. I was born in Brooklyn, and as a Brooklyn kid, you're used to being very busy, to moving around a lot, to maximizing your resources. So for me, being in the New York, New Jersey area, it's a great place because you've got the 5 boroughs in New York, you've got Northern Jersey, Central Jersey, South Jersey. You've got this hotbed of activity, so many people to help. So I try to maximize my range geographically. So I have multiple offices in New Jersey, multiple locations in New York. I've got a great team to keep us organized, and the more people I can touch and help, the better. So it keeps me inspired, and it's a wonderful thing.
I want to talk a little bit more about Rhea. She really had a glow up before and after her surgery. Tell us more about her injury and about kind of her road to recovery and what's happened for her since.
So when I met Rhea, she was a young attorney, just getting started in practice. She had a lot of pain in the back, radiation down her leg, her left leg. She had weakness, just very concerned. And I knew that as a high-level person, as a high performer, she needed to be able to get back to just getting her career going. So I was very clear with her imaging, her MRI. She had a large herniated disc, L5-S1, impinging on her S1 nerve root, a lot of pain down the leg. She had a weakness developing already. So I explained to her what was going on. I let her know the options. I felt that if we waited for too long, that she could potentially have symptoms that may persist longer than we would want, that could potentially inhibit her going forward. So we decided to get it done. So I did a procedure called a microdiscectomy. So usually with that, I use a microscope, small incision, I work through tubes, take a little bit of bone to get down to the spine. I found the herniation, took that off the nerve. The nerve had great decompression. So I felt very confident during the procedure and after that I had accomplished what I needed to. And post-operatively, she did great. She had almost immediate pain relief. She was walking much better. We started her doing physical therapy 6 weeks post-op. And now you can see how great she's doing. I mean, it's amazing. Like, she's in court, like, she has all these great cases, a very busy practice. I'm very proud of her and proud of myself for contributing to her being as great as she is.
We talked about the stunt woman, we talked about the lawyer, and now let's talk about Patrick, the gospel singer and sports broadcaster. So he came to you and he was more concerned with a little bit higher than Rhea in his neck.
Yes.
Tell us more about Patrick.
So Patrick is a great gospel singer, a great broadcaster. I've seen some of his work, amazing. A lot of people who use their voices for their work are concerned when it comes to having neck surgery. There's a nerve called the recurrent laryngeal nerve. And whenever we're doing neck surgery, there's always a chance that that nerve can get stretched and people could have some potential issues. So I make that clear before they have the surgery. The odds of that are very low, but patients who use their voices for their careers are very concerned about that. So I have to really reassure them. Patrick had 3 levels of impingement in his neck, so he needed a 3-level decompression. So he had done the physical therapy like everyone else. He had done the injections. Nothing else was working. He had horrible pain in his neck going down into his arm, so he absolutely needed the surgery. So I did a 3-level ACDF, anterior cervical discectomy infusion. With that procedure, I usually use a microscope. I make a cut on the left side of the neck. It's a blunt dissection to get down to the neck. Removed the 3 herniated discs. Did a beautiful fusion on him. That procedure typically takes about 2 hours, 2.5 hours. Most patients are in the hospital for about 1 or 2 days. Patrick did great in his hospital stay. He sent me a video about 3 months after surgery, and he was in choir singing, and it was phenomenal. And he sent me a bunch of videos of him broadcasting games, which is phenomenal. Like I've emphasized, the key is really education. You know, like the odds of things going wrong are very low, but patients just need to understand exactly what they're getting into, have a good sense of expectation. And as long as you get them feeling comfortable and they feel like they're a partner in the decision-making, we often get the outcomes that we're looking for. And Patrick was a shining example of that.
It seems like it's such a double-edged sword where we want to wait as long as we can to do the surgery, but then at the same time, the surgery is what's actually going to give you the quality of life back.
Absolutely.
Talk to us a little bit more about that.
So it's very individual for different patients. So if you have a nerve issue where there's weakness, then that often pushes the trigger a little quicker. A lot of patients, if it's strictly pain, they do well without having surgery at all. If the pain's persisting or there's a functional issue, then I'll go over the anatomy as to why we may need to do something. And as long as they've kind of gone through the steps, then we'll perform surgically. But the key is just education. The key is education. Just know what the expectations are. And if we can prevent progression, ultimately that's the goal. Prevent things from getting worse. And then that gives you a chance to get better and get back to your life.
Dr. Okubadejo, I understand that you are quite the fitness enthusiast, and that's something that's been a passion of yours throughout your entire life. But there's something you shared with me that really married your passion for fitness with what you learned becoming a spinal doctor.
I started working out on a regular basis, probably in high school, honestly, when I was 17 years old. And I just wanted to feel stronger and just feel I had more control of my body. And as soon as I started that process, a lot of emphasis has gone into core. So I've always been fascinated with the core. Interestingly, as my interest in spine developed, I realized that core strength and a healthy spine go hand in hand. So it was a perfect marriage, a perfect merger. So doing core exercises over the years, you do a lot of the standard exercises, planks, sit-ups, leg raises, and I came up with certain movements. I work with design engineers. Proud to say I now have 2 products coming on the market strictly for core. So I've got 360 Coreboard, which is a 360 device, dynamic movements. You can be very creative with the movements with that. Another product called 360 Dynaflank. And they both add to the spectrum of core fitness equipment. Most importantly, they add to the creativity you can come with strengthening your core. So I think just having that variety can make your workouts very interesting while still emphasizing core strength, also marrying it right into spine health. So it's a perfect marriage altogether. 360coreboard.com has all the different movements that come with 360 Coreboard. So begin with just the basic movement going back and forth, and then start adding rotational movements. And I think if you have a balance of both, you feel like you're getting a full workout and your core is truly getting both movement and strength at the same time.
What mistakes do you see people making when exercising or strengthening their core?
When it comes to core strength, I think a lot of people put too much stress on their backs. A lot of people don't have good form and they put too much stress on their backs. The bigger thing that I see in gyms actually is a lot of people do things that are injurious to their spines. So there are 2 particular exercises that concern me when it comes to being in the gym, especially as you get older. You get older, your disc has a little less buoyancy, less fluid, the risk of injury is higher. A lot of people still continue squatting as they get older, and that axial force puts a lot of pressure on the disc, and the odds of having a disc injury, herniation, or a variety of that becomes higher. A lot of people do deadlifts, and I'll ask them, what's your objective? Because with the weight in front of your body, that axis of rotation puts a lot more stress on the disc, and the risk of having a disc injury, herniation, way, way higher. So I think people really need to be conscientious as to how they evolve their routines as they get older, keeping in mind that their bodies are changing as well. So one of my goals is to really educate people on that to prevent injury.
You are an avid golfer, an avid golf fan. Where did that passion come from?
So my initial interest in golf began in residency. So in residency, we had an annual golf event where the whole program would get together and we'd golf, and our chairman actually would always favor the better golfer. So it's to kind of curry favor with the chairman, you want to be as good a golfer as possible. Unfortunately, I never got to that level while in residency, but the passion remained. So I've golfed now for years. I have friends that I've golfed with for years. I see them getting older, and I want to make sure that they maintain their function as they get older. So I've given a lot of thought into how you can maintain your body, maintain your movements as you get older. So I've put a lot of thought to merge my interest in core strength, my interest in fitness, and my interest in golf to kind of put them together. And I'm putting together programs for golfers so they can maintain their abilities as they get older. I'm looking into studying the movements of golf, seeing what movements can cause injury, how to prevent that, and just how to have better wellness overall. Look out, there's a lot of interesting things coming from me.